Here's what's coming up on the world today. The 2020 Olympics officially opens today, beginning with fireworks over the National Stadium in Tokyo. As we report the global pandemic, researchers in the UK say a longer gap between the first and second doses of the Pfizer-BioNTech vaccine makes for better antibodies. Plus, Haiti's President Jovenel Moise is laid to rest 2 weeks after he was shot dead at his home in Port-au-Prince. A warm welcome to our viewers here in Nigeria and around the world. Thanks for joining us on the program. I'm Amarachi Ubani in Lagos. The 2020 Olympics is off to a great start with a colorful opening ceremony, beginning with fireworks as we see them exploding over the National Stadium in the capital in indigo and white. They're the colors of Tokyo's Olympic emblem. The opening ceremony itself took place without the usual mass choreography, the huge props or the cornucopia of dancers, actors and lights associated with past celebrations because of the coronavirus pandemic. And only a vastly smaller number of athletes marched in the team's parade, and only 15 global leaders attended the ceremony, along with Japanese Emperor Naruhito and US First Lady Jill Biden. On the other hand, hundreds of protesters carried placards that read "Lives over Olympics." Just outside the National Stadium, they were a mix of people with white surgical masks. The Olympics were postponed for a year, and organizers were forced to take the unprecedented step of holding the games without fans as the novel coronavirus is on the rise again, taking lives around the world. The UK's Office for National Statistics has released data from its weekly COVID infection survey, showing that in England, almost 750,000 people in private households are likely to have had coronavirus in the week to July 17. Meanwhile, in Italy, you'll need a coronavirus COVID pass indoors to actually stay indoors and to dine at different venues. Here's a global update.
The Italian government says people will need to show a digital green certificate to gain access to a range of indoor venues, including restaurants and cinemas, from August the 6th. Anyone over 12 will be expected to demonstrate they have had at least one jab, tested negative, or have recently recovered from the virus. Prime Minister Mario Draghi says the expansion of the use of the EU certificate scheme is essential to keeping businesses open. Meanwhile, the French government's advisor on COVID-19 says a return to normal life following the COVID-19 virus outbreak may not occur until 2022 or even 2023. During a TV interview, he said France could reach around 50,000 new daily COVID-19 cases by the beginning of August, and warned against going to nightclubs despite their reopening, and that the fourth wave of a new coronavirus infection should hit French hospitals in the second half of August. Iran's supreme leader has received his second dose of a homegrown COVID-19 vaccine amid a fifth wave of the pandemic in the country. He received his first dose in June. Iran is the epicenter of the pandemic in the Middle East, with a total death toll of over 88,000 people and more than 3.6 million cases.
You're all here. I'm in the group of labor and business.
Finally, U.S. President Joe Biden asked whether vaccinated Americans would be asked to wear masks again as COVID-19 cases rise, says his administration would follow the science. He emphasizes that newer infections are affecting people who have not been vaccinated.
You're all here. If you are vaccinated, you are safe. If you are vaccinated, you have over a 98% chance of never catching the virus at all. If you catch it, you're likely to, the overwhelming proof so far is you're not going to be hospitalized, you're not going to be sick, you're going to probably have no signs that you had it, and you are not going to die. So
The president's remark comes as COVID-19 cases are climbing in some states in America. Vaccination efforts stall on skepticism and disinformation.
Meanwhile, in the UK, the government is exempting supermarket depot workers and food manufacturers from quarantine rules as it's trying to prevent food supply problems. The government says workers, regardless of vaccination status, could do daily COVID testing instead of isolating. The new daily contact testing measures are beginning on Friday at 15 supermarket depots followed by 150 depots next week, but will not apply to supermarket store staff. Even then, researchers in the UK say a longer gap between first and second doses of the Pfizer-BioNTech COVID vaccine makes the body's immune system produce more infection-fighting antibodies. Experts say the findings support the UK's decision on extending dosing intervals from the initial recommendation of 3 weeks. An 8-week gap seems to be the sweet tooth, rather, for tackling the Delta variant. Let's talk to Channels Television's correspondent in London, Ijoma Onyato. Ijoma, great to see you. And let's see if I understand this. The rules are changing for supermarket depot workers and for food manufacturers because the government wants to prevent a food supply problem. But is the government also considering a surge in cases as a result of this small move?
Hi, Amara. Thanks. Great to see you. It's changing by the minute, I can tell you. It's a very interesting time to be in the UK. Now, when you look at the rise, it is not quite following the mathematical mode, like you would put it. You've had only about 600,000 people actually pinged to self-isolate. And one of the reasons why you see supermarket owners complaining is because they don't want to see the kind of empty shelves that they saw during the lockdown last year. And so the plan is, rather than have a 10-day isolation period where supermarket workers don't come in, if you're pinged by the NHS Test and Trace app, do a lateral flow test and see if you're negative. If you're negative, you can still come in. You don't actually have to isolate for 10 days. So you're not going to see a rise in figures because they're going to come in regardless, but they are going to have to test, ensure that they're negative, and then they're going to come in. Now, the trouble is that it's different for different service providers across the UK. So you find people in the food service industry, veterinary medicines, waste industry, the water industry as well. But then it changes rapidly when you look at Northern Ireland, when you look at Scotland. There are different apps for the different regions, and everyone is a little bit confused about what the new rules are supposed to be. So I went down a number of restaurants today. I'm in one at the moment, and many of them are saying that they're worried about having their staff isolating for 10 days. Will they be paid if they're asked to sit at home because the government asked them to do so? And how will that affect the opening of restaurants who, things are only just beginning to open up? So there's a lot of uncertainty, Amara, around it, but it isn't a perfect science. And they're not saying, come in if you work in the food industry, if you're positive, you still do need to test to see if you're negative, and then you can come in without waiting for 10 days.
And what about this research, this study by researchers in the UK about the gap between the first and the second doses? Has it in any way impacted on, the reason why the restrictions were lifted? Have there been a rise in vaccinations in the UK since then?
Well, there is a rise in people going to vaccination centres but not actually being vaccinated because many of them have not reached the 8-week benchmark. And the science says that giving your body that 8-week time lag, you have a better chance at surviving if you get the Delta variant, not just any other variant. But a lot of people who have just 5 weeks from the first dose that they took are rushing to those centres to try to say, I want 2 jabs because I want to travel. But what the doctors are trying to say is that your body needs time to actually build up and then boost and then have the immunity. And it takes 8 weeks to do that. The real guidelines on the NHS England say 8 to 12 weeks. So 8 is really the base minimum. But many of them are citing the CDC in America saying, well, that says 4 weeks. But unfortunately, for people who are being turned away, NHS England is in control where we are. So yes, people are rushing to try and get vaccinated, but whether they are being vaccinated it depends on what your vaccination card says. So if you do see that rise, it's because you see a rise in people who are qualified for the 8-week gap, not necessarily because they're rushing to a pop-up center to get vaccinated. At least that's what the science says for now.
Our own Ijoma Onyato on the road to Britain's freedom from the coronavirus, as people have put it. Thanks again for speaking with us, and do stay safe, of course.
Welcome. Thanks.
Staying with more health issues, it's been a week since a Texas man was confirmed to have monkeypox after traveling overseas. Now, the U.S. Centers for Disease Control and Prevention says it is monitoring dozens of people who may have come in contact with him. Since the original monkeypox diagnosis in Texas, the Centers for Disease Control and Prevention is monitoring over 200 individuals in 27 states and a few other countries. The patient flew into Atlanta, Georgia on July 9th from Lagos, Nigeria, and then went on to Dallas. He was admitted to a hospital in Dallas. The individuals being observed either know they were around the monkeypox patient or were on the same flight as the man. None of the individuals being monitored is considered high risk, and so far no additional cases have been found. Internal medicines expert Dr. Nelson Aluya joins us now from New Jersey. Dr. Aluya, it's great to have you on the program. What do we know now as far as infections concerning the monkeypox?
Well, thank you for having me, Amara. It's a pleasure once again to see you. Yes, monkeypox, it's an unusual, rare infection caused again by virus. But with less affectability and less risk of infection as compared to most of our viruses, especially the smallpox. It's actually a relative in the same genus like smallpox. And of course, you know, smallpox is a very deadly disease that was eradicated in the 1970s, especially in 1971 when there was a mass global effort of vaccination to eradicate the virus. So it's unusual, it's rare, but it's going to raise its head again once globally.
How dangerously in the mix will the virus be with the coronavirus that's already out there? The U.S. has the highest number of coronavirus cases.
Well, as we know, coronavirus it's very deadly, especially for those with pre-existing medical conditions. And one of the things that's very common with the coronavirus is actually really depletes your immune system, your ability for your immunity to fight diseases against the virus and every other virus. So if you combine monkeypox with this, I'm sure it'll be a lot more deadly as compared to if it was just by itself. Like I said earlier on, the monkey virus is not as deadly as the smallpox, but it actually can result in death. The one that was described in Texas, the particular strain, which is the West African strain, actually have 1 in 100 deaths that emanates from it, as compared to the Central African strain, where you have 1 in 10 deaths that come out of it.
So very quickly, what will be the symptoms just before the pustules begin to show up on the skin?
Well, it usually begins with a fever, headaches, generalized muscle aches and pain, and of course, exhaustion. And then the rash or the skin lesions begin to manifest. It lasts about 2 to 4 weeks. And in some individuals, it actually can last up to 20 weeks for infection, depending on what your immune system looks like.
Dr. Aluya, it's been a pleasure speaking with you. Thank you. And we'll be reaching out to you again to talk some more about other health issues. Thanks again, and do stay safe.
My pleasure. Thank you for having me.
Happening earlier today, the people of Haiti laying to rest President Jovenel Moise amid protests from angry protesters, and supporters of the slain leader in his hometown. President Moise, as we remember, was gunned down in his home in Port-au-Prince earlier this month, setting off a political crisis in the Caribbean country. Overnight on Thursday, laborers set up stages, lights, and paved a brick road to Moise's mausoleum on a dusty plot of several acres enclosed by high walls in the northern city of Cap-Haitien. France's President Emmanuel Macron has changed his phone and his number, following reports that he was targeted with Israeli-made spyware called Pegasus. He has also ordered an overhaul of security protocols. French media this week reported that the president and 14 of his ministers were flagged for potential surveillance by Morocco. Moroccan authorities have denied using Pegasus, saying the allegations are unfounded and false. On Wednesday, German Chancellor Angela Merkel said it is important that hacking software does not get into the wrong hands. She also said countries without any judicial oversight of how spying software is used should not have it. An investigation published on Sunday by 17 media organizations said Pegasus spyware, made and licensed by Israeli company NSO, had been used in attempted and successful hacks of smartphones belonging to journalists, government officials, and human rights activists on a global scale. Let's bring in IT and cybersecurity expert Adedoyin Adedeji. Adedoyin, thank you for joining us on The World today. Maybe we should begin from the beginning, as we like to say here. How invasive is this malware, and how can you tell a malware your device has been infiltrated with a malware?
Okay, good day, everyone. Well, it's a bit difficult for you to say or to determine whether you are infected or not, because this particular software is quite invasive, and it usually leverages on what we call zero-day vulnerability, meaning these are vulnerabilities that most of the software makers have not even identified as a vulnerability. So it leverages on this kind of vulnerability to attack mobile phones, and it's not very, very easy to track. Most of the time, because of the nature of its operations, even the user of the mobile device or the laptop might not even be aware of what is going on, because basically what it does is to majorly spy on potential victims, check their call logs, record their audio conversations, and also one of the key things it does is to probably pull their contact information and every other information in their inbox and SMS inbox. So it's quite invasive, and it's a bit technical to identify when it's operational on your phone. But one of the few quick tips you can use to know whether this is happening on your phone is, number one is when your phone is behaving abnormally. What I mean is, for example, sometimes they can gain access to your email address and try to read your emails, and your email service provider would tell you that, oh, there's another new device that is connected to your phone or to your email service. Confirm if it is you. Most of the time, we don't pay attention to those kind of little details. But then I've seen journalists that they're able to hack their email addresses using some of these tools. And you can see that the person accessing your email address is not even in a location you've ever been to. So you could, for example, be in Nigeria and somebody in maybe Algeria or somebody somewhere that you've never been to is accessing your email, and the service provider is telling you this person is accessing it from this particular location. So number one is paying attention to irregularities in your online communication. So if you feel that, number one, you are getting, the access to your online accounts from places you don't know, it could be a sign that this is happening. Also, sometimes it could be as simple as you missing some of your information, or when you are trying to call, your phone does not behave the normal way it should behave. So I think it's just paying attention to details is probably one of the easiest way you can be sure that this is happening on your mobile phone.
And how can we protect against it?
Well, most of the time, I think the quickest way the easiest way to protect against this is, number one, is first of all, update your devices. Most of the time we use devices and we do not update our softwares. Most of the time when you check your internet service provider, when you check your mobile phone, you will see that there are a lot of updates which you need to update. Now, some of the security flaws, or what we call the zero-day vulnerability, that they were able to use to access your mobile phone. Most of the time when these exploits come to light, the software makers or the mobile phone makers will usually provide updates. So it's always very important that people update their devices whenever there are updates. At least for most mobile phones, at least once or twice a week, update your mobile phone. You update your apps, update your iOS or Android, update it as you get the update, always update it. Then secondly, have an antivirus. Now, when things like this happen, most antivirus companies will pick samples of this malware and add it to their code base for their antivirus to detect. So, but if you have an antivirus and you don't update your antivirus to the latest definitions, that's virus definitions, yes, you might have it and your software might not pick it up. So, but what you can do really is, if you have an antivirus on your phone and also on your laptop, update it from time to time, and it can always detect some of these things as it happens.
Adedoyin, you have been a big help to us. Thanks again for joining us on The World Today.
Thank you very much for having me.
And as we end the program, finding a place to live can be a real hassle. It's also a pain having to pay rent. But one Egyptian woman has turned a bus into a tiny home, meaning she will never have to pay rent again, probably. Let's take a look at her story. Yara Shalabi will no longer need to pay rent nor worry about a place to live, probably for the rest of her life. And it's all thanks to her creativity and willingness to take on the daunting challenge of putting together her own house or bus. The banker and Egyptian rally racer bought a bus that would have been otherwise abandoned and sold for scrap and turned it into a tiny home for herself and her son. The challenge, however, was the construction. And with close to no models to replicate, she had to be creative.
It's a mobile house that has every aspect of comfort. I made sure the design looked exactly like all the videos of houses I had showed my son when I was convincing him with the idea, because in the beginning he wasn't on board and he had concerns. I used to show him photos of similar houses that people built outside Egypt. He saw some photos that he liked and told me that if it were to look exactly like those, then he's on board. So I promised him that it will look like it, and I stuck to that.
By designing its structure to allow for ease of movement, she increased the height of the ceiling, adding air conditioning vents and attached solar panels to the roof. She also used natural wood paneling on the floors, tables and walls to keep a flow with her surroundings.
And this is what helped me realize this dream, which at the beginning was just an idea for a vacation home for travel or camping, to an economic idea, a livable alternative house. I made sure that all the design elements included comfort so that I didn't feel as though I had left my house, but instead I still live at home with my appliances in a smaller space. Yes, but at least it is my own. I'm not wasting my money on rent.
Shalabi ended up paying only 10% of the cost of an average apartment, with her investment totaling approximately 350,000 Egyptian pounds, including the price of the bus, while at the same time ditching monthly rental payments on the long run. She plans on using the bus as a permanent home, but also a safe means of transportation and lodging for her frequent excursions into Egypt's vast deserts. How lovely and how peaceful. Thanks for watching The World Today. I'm Amarachi Ubani. Enjoy your weekend.